What are eye-opening solutions to common mental health conditions? Welcome to Peace Unplugged. I'm your host, Martin. Today, we're going to dive into 5 key questions that consistently pop up in mental health searches, offering insights, clarity, and practical advice. To keep this authentic, I'll be sharing some elements of my own personal experience of mental health issues that you are likely to recognize. Just as a warning, some of this may trigger you, so please be aware. Take breaks if necessary and seek professional advice. These are questions many of us have asked or will ask at some point in our lives. Please make sure you listen through to the end to ensure you get key resources from myself and other links. So let's get started then. Our first question, and a very common one, is what are the symptoms of depression? This is a crucial starting point because depression is a serious mental health condition that can significantly impact our daily lives. I know this very well from my own experience, bounce of from bouts of depression throughout my life. It's more than just feeling sad. The symptoms can vary from person to person, but generally they fall into a few categories. What are the emotional symptoms? The most well known is a persistent feeling of sadness and emptiness or hopelessness. For me, this involved a significant loss of self esteem. Bouts of it would come on suddenly and occasionally triggered off by one encounter or conversation, which to many may seem insignificant, but to me would result in hours and days and weeks of ruminating. It can also manifest as irritability, frustration, or a loss of interest or pleasure in activities that I once enjoyed. You might feel tearful without knowing why, or in some cases for me, wanting to cry, but not able to do so. It is experiencing feelings of worthlessness, of guilt. Okay, so what are the physical symptoms? Depression isn't just in your head. It can show up in your body too. Common physical symptoms include disrupted sleep, otherwise known as insomnia, or sleeping too much. It can include changes in your appetite, changes in your weight, persistent fatigue or loss of energy, and even unexplained aches and pains, headaches or digestive issues. My personal experience was a loss of appetite. A few years ago, I had a severe episode. The only escape for that was to sleep in order to avoid reality at the time. Okay, so what are the cognitive symptoms? Well, your thinking can be affected for a start. You might find it hard to concentrate. You might find it hard to remember things or to make decisions. There might be a general sense of feeling slowed down mentally. I describe that as like a computer needing to be defragged. In other words, my brain needs to empty, get rid of all that data that is obsolete and outdated, giving space for fresh thoughts. What are the behavioural symptoms? Well, you might withdraw from social activities, neglect responsibilities, or have thoughts of self harm, or perhaps wanting to end your life. This last one, thoughts of self harm, it is extremely serious. If you know somebody who's experiencing this, please reach out immediately to emergency services or a crisis line or a trusted professional. These behaviours can be very covert to the observer. Watch out for sudden changes in behaviour. These can sometimes move into what seems like just very ordinary, perhaps upbeat behaviours or calming behaviours. The important point to mention here is that the sudden change could indicate something a little bit more serious. These feelings and changes typically need to be present for at least 2 weeks, and they will represent a noticeable change from usual functioning. If you're recognising a few of these, please keep listening, as our next few questions will build on this. One of the questions that often comes up is, am I having an anxiety attack right now? Anxiety attacks, more often referred to as panic attacks, can be incredibly frightening. They come on suddenly and involve intense physical and psychological symptoms. If you're experiencing one, it can feel like you're losing control, having a heart attack, or even feel like you're dying. When they pass, they can feel like acute embarrassment. Again, my personal experience of that is involved guilt and also self-judgment, followed an acute depression. Here's what panic attacks often feel like. So what are the physical sensations? You might experience a racing heart or palpitations, a shortness of breath, feeling like you're suffocating or choking, chest pains, discomfort, dizziness, lightheadedness, nausea, trembling, shaking, sweating, or chills and hot flashes. Our body goes into full fight or flight at these moments. Okay, so what are the mental and emotional sensations? Alongside the physical, there's often an intense feeling of dread or terror, fear of losing control or going crazy, and a sense of unreality, where things around you or even your own body don't feel quite real. This, along with the acute depression, felt for me like being in a bubble, not connected to reality. Everything going on outside, feeling of invisibility. I've got to say, it's a very lonely place to be. Panic attacks normally peak at around 10 minutes and then they gradually subside. I have to say, the anxiety can still linger. If you're experiencing these symptoms right now, try to focus on your breath. As I've explained in many other podcasts that I've done on this channel, just a quick review: take slow, deep breaths in through the nose. Hold the breath in the lungs and then release the breath out through the mouth. Another thing we can do is you can ground yourself. Look around you. Look at what you can see. Experience what you can hear. Experience what you can smell. Experience what you can taste. Be aware of the temperature. Essentially, do that without judgment. This technique, this mindfulness technique, is to bring you back to the present. Remember, if you're in a panic attack, you may at the time feel like you're never going to come out of it. But in truth, we do come out of panic attacks. The time does pass. The panic attack feelings are simply temporary and they can't physically harm you. If you experience these frequently and they start to have a bit of an impact on your life, it's a good sign then to seek some professional advice and help. So the third question I'm going to ask is, how can I stop myself worrying? We see worry is a natural human emotion, a way our brain tries to anticipate and solve problems. But when it becomes excessive and uncontrollable, it interferes with our life and it's no longer helpful. Whilst we can't stop worrying entirely, we can learn to manage it. Here I suggest some strategies. Set aside a time in your day, say 10 to 20 minutes, and call that your worry time. When you do that, just focus on that worry time. Make sure that you focus on those worries in that specified time. If you then find that you're starting to worry outside that specified time, what I suggest you do is just briefly acknowledge it. Tell yourself that you'll deal with it at a later point during the times you've set aside for your worry time. And then you'll be able to redirect your focus. When you've come to your worry time, sit down and focus on it. And I suggest start to write down those worries. Journaling, as I've said before in other podcasts, is a great way of dealing with worries. It's a great way of exploring by reading back what you've written down. And this can often actually reduce its power over you. Challenge your thoughts. When a worry arrives, ask yourself, is this realistic? What's the evidence of the thought? What's the worst case scenario? And can I cope with that? What's the best case scenario? Is there another way to look at this? Again, I suggest practice mindfulness. Just a reminder, mindfulness is about staying in the present. When you notice yourself worrying or dwelling on the past, gently bring your mind back to the present and focus on the senses, what you can see, hear, smell, taste, and feel right in the moment. You can engage in some distraction activities. Sometimes the best way to stop worrying is to redirect your energy. Engage in an activity that requires focus, a hobby, some exercise, perhaps cleaning or another task. I find that going for a run, or in fact these days actually going out for a brisk walk due to my current physical condition, it gets me out into nature. If the worry is about something you can act on, I suggest break it down into small pieces or small manageable steps. I associate this when I used to go for 5k runs. I'd get so far and want to stop because I feel out of breath. But I wouldn't actually stop running. I might slow right down. but perhaps focus on a lamppost quite a few yards ahead of me and say, right, just going to run as far as getting to that one lamppost. When I get there, I then decide I would focus on the following lamppost. I found that by focusing, I'd stop worrying about feeling out of breath and stop worrying about feeling tired, and then feel like I was actually achieving something. This I then found built my confidence. The next thing to do is to limit information over, especially with the 24/7 news that we get today. It's so easy to get overwhelmed. Be mindful about how much news that you consume, and this is especially important before you go to sleep. These techniques, of course, require practice, but with that practice, you can significantly reduce the grip of the worry. So what next? Is a highly relevant connection to many people. How do I cope with workplace stress? Workplace stress is endemic in our modern society. It can significantly impact upon our professional performance and of course also our personal well-being. Coping effectively with this is key to preventing burnout and maintaining our mental health. So here's some strategies for managing. First, identify the stressor. Pinpoint what is actually causing that stress. Is it workload deadlines? Is it difficult colleagues? Is it a lack of control? Or is it something else? Understanding the source is very much the first step. Next is the very important boundary setting. I've got to say this is really crucial. You've got to learn to say, especially when you're at capacity. Establish clear start and end times for your working day and stick to them. Avoid checking emails outside of work time, unless, of course, they're absolutely necessary. Same goes for working late. Don't work late unless it's absolutely necessary. Take time to evaluate whether that is really necessary to work that late, or maybe what's needed is it can be left to the next day. So what I'm saying is protect your non-work. I've made this classic mistake in the past. It was done as a desire to be recognised and to be successful and perhaps to get promoted in the job I was doing at the time. I'd also got all the responsibilities of paying a mortgage and having a family. I found myself working long hours. I found myself not switching off from work. Essentially, I was chasing career dreams for which my employer had no real care of, quite frankly. I found I got taken advantage of on several occasions. Next up is time management and prioritisation. Use your tools like to-do lists. Mark down what is important first. Now, actually, what probably is most important at the beginning of the day, even when we get up out of bed before we go to work, is to realise that we need to actually fuel ourselves with a bit of breakfast. I'm as guilty as the next person for not doing this, even today. So again, I'm simply reminding myself of what is important. I also think it's important to prepare our mind and body before we go to work in the morning. So I often do that by using some mindfulness and meditation techniques. I found that by doing this, it can make large workloads feel much more manageable. Also, communicate effectively. Also, if you're feeling overwhelmed and you feel able to, talk to your line manager or perhaps HR or perhaps to some trusted work colleagues. They may help you find a solution. Essentially, be clear about what sort of support you're seeking. This kind of open communication can, in many cases, solve the problem or certainly sort the issues before they escalate and get out of hand. The most important point is don't suffer in silence. Make sure you take regular breaks. Step away from the computer. Step away from your desk. Go for a walk down the corridor. Grab yourself a glass of water or just go and make yourself a drink. Take a stretch. Take a moment to close your eyes, even if it's just for a few minutes. You see short breaks can improve our focus and it also reduces our mental fatigue. Make use of support systems. So that means talking to colleagues that you trust, talking to your friends and your family. If you're lucky enough to work somewhere that's got an employee assistance program, then make use of it. Sometimes these provide confidential counselling advice. And your self-care outside of work. Don't let work consume your life. Dedicate your time to hobbies, to exercise, and spending time with friends and family and loved ones. Do activities that bring you joy, activities that help you to and of course physical activity is a powerful de-stressor. Remember, your well-being should come first. If workplace stress becomes unmanageable, it might be time to consider getting some professional advice. That may even mean looking for a different job or working in a different environment, perhaps moving to a different department in the workplace that you're at. Finally, we come to a critical question, and this connects us back to the previous points. That is, if you're worried about it, ask yourself, how do I know that I'm clinically depressed? So it's moving beyond the self assessment we may make of ourselves and moving it to a formal diagnosis by a mental health professional. So while recognizing the symptoms is useful, in fact vital, clinical diagnosis of depression, also known as a major depressive disorder, or sometimes known as clinical depression, that can only be made by a qualified healthcare professional. Here's why this distinction is important and what it involves. It's about the duration and severity. Clinical depression is characterized by a persistent low mood or loss of pleasure in activities for at least 2 weeks, alongside a cluster of other systems, as we discussed earlier. Those symptoms being severe enough to cause significant distress. It may impair our social connection with people. It may impair our occupation or many other areas of functioning. You see, it's not just about feeling down. It's about how those feelings can disrupt our daily lives, our ability to work or to study, or actually to maintain relationships, or just to manage self-care. You see, a professional will rule out other medical conditions, medication side effects, or perhaps there's a substance use that's causing the problem. Now, from my experience as a former professional, this is where things can get complicated. You see, because as human beings, we do tend to try and self-medicate where we're not feeling 100%. That can be with drugs or alcohol, even very simply a cup of tea in the morning that's got caffeine in it that can give us a perk up. Most people do this. It is in fact a way of trying to manage our. So it is in fact a way of trying to manage. So it is in fact a way of trying to self-manage our mood. In my opinion, professionals need to ensure that they are being non-judgmental and curious and listening carefully to anybody that presents with these symptoms. That way, the professional will be able to separate what is perhaps maybe circumstantial feeling low, perhaps from a bereavement or a life event, a big life event that's changing, to what may be actually clinical depression. See, mental health professionals use a specific criteria, tools to do this. And what they'll do is they'll create a treatment plan. Once they've diagnosed, they can then create that plan together with you, making sure that it's individualized to your own circumstances. This might include some psychotherapy or some counseling. It may include some cognitive behavioral therapy. It may include some medication, such as antidepressants. It may recommend some significant life changes, or it could be a combination of all of these. I suggest it's also worth considering some holistic solutions. To that end, I'm a great fan of traditional Chinese medicines, as not as a replacement for, but as enhancement to other treatments. The most important takeaway here is this. If you think you might be experiencing clinical depression or any other significant mental health issue, the best and most crucial step you can take in the first case is to speak to your or a GP at some point, or at least a mental health professional. These people are trained to assess your symptoms. They'll be able to provide you with an accurate diagnosis and then to guide you to the most effective support. So what I'm saying is, don't just on its own rely on self-diagnosis, and be cautious about information that you find online. As much as it can be useful in some ways, on its own, it's not the full answer. It's always useful to get advice from professionals. Okay, so we've covered quite a lot today, from understanding the signs of depression and anxiety attacks to practical ways of managing worry and stress management, in particular workplace stress. Importantly, how to seek a clinical diagnosis. Remember, taking care of your mental health is just as important as taking care of your physical. And of course, it's not a sign of weakness to ask for help. It is, in fact, a sign of great strength and wisdom to seek help in these issues. If any of this resonates with you today, please consider reaching out to a healthcare professional. In the UK, you can always start with your GP. There are also many other fantastic sources of help out there. There are many small charities, localised charities that can help, as well as organisations like Mind and Rethink, and of course the Samaritans. All of these offer support helplines and also resources. So folks, don't suffer in silence. I suggest it is useful to do further research. Simply by seeking to understand the workings of our mind, we can discover methods to manage it effectively. Now, I've presented many other podcasts that delve much more deeply into this. I've done episodes on meditation. I've done episodes where I've interviewed people from around the world who all have some great insights into health and well-being. So I appeal to you now to subscribe to this podcast channel. That way you'll have easy access to all those other resources that I've created, but also there'll be links to other places and other professionals as well. So please subscribe to podcast Peace Unplugged. Thank you for joining me today, and look forward to some further episodes I'll provide along similar lines. Until the next time, take care of your mind. Take care of yourselves. If you enjoyed this podcast, please follow, like, and share. Thank you very much. Martin, Peace Unplugged.